I'd like to take you back to Wednesday, when in America, Dr. Anthony Fauci suggested that the British procedures were too rushed, and he hinted they were not thorough. Since then, he has fully corrected and withdrawn the statement. But he echoed what many people are saying. People are concerned that it's been done in 10 months and not 10 years. Do you have any comfort for them?
There are a couple of things within that statement, Andy. I think firstly we need to understand the position we're in with the pandemic, the severity of this illness, the fact that for the first time ever across the globe, a lot of the red tape around manufacturing, around medicines being registered has been lifted. So a lot of the delays are often around some of the paperwork-based exercises. So we need to take that out of it. And I suppose the reality is we don't have 10 years, unfortunately. What we have learnt about this virus is that the immunity you gain from it doesn't last forever if you get it. So people are getting it time and again. We're not getting control of it without a vaccine. And aside from the direct impact that we see from coronavirus, the secondary impact on mental health, on our economies, on poverty, and on general health care and being able to deal with other healthcare related issues is immense, and we cannot continue. So there has to be a solution. I think as regards the two pharmaceutical companies that have come up with the vaccine, an extreme amount of work has gone into that, rightly so. I've done a lot of reading, a lot of discussing with people around what the vaccines are, what the results are. I think they have been as vigilant as they possibly could be. I also don't believe that these companies would be releasing this vaccine if they had any significant fundamental concerns. Ultimately, this will be going to everybody, including their families. But I think it's useful just to go back to what coronavirus is and why this is such an issue. Coronavirus genus has been around for a very long time. We'll remember the first time that there was a lot of global concern was the avian flu, the SARS, and it's one of those family of viruses. It's an RNA virus. The reason making this different isn't necessarily that it's much more deadly, but that it spreads much more easily. So on average, RNA viruses 2 and 4 on their replication rates, and coronavirus has a rate of 5.7. So the infectious nature is much greater, and it spreads much quicker, it also replicates quicker, and that's what makes it so difficult to manage. What we then know happens with the coronavirus is that it does attack the respiratory, so the breathing system, and it causes an inflammation in the small airways and a significant drop in oxygenation and the oxygen saturation for the patient. So what we find is that elderly patients who've got underlying heart or lung disease are particularly susceptible. But we also know that if you have additional illnesses like a pneumonia, a chest infection, a flu, you become very susceptible to this virus, and when infected by it, you have very poor outcomes. We also have seen that repeated coronavirus infections are quite dangerous, so constantly being exposed to coronavirus in itself holds its own risk. Why it's really important for us to get a vaccine. The fact that vast proportion of the population has been okay and has either contracted coronavirus asymptomatically or has recovered from coronavirus, we cannot vouch for the fact that that will remain the status quo. Having looked after patients in the hospital, some patients who sadly died from coronavirus, it is an extreme disease. It is a disease that we haven't seen before. It is a very difficult disease to manage, and it's a very difficult disease for patients to have. I think there is a need. Globally, there's been a call for a vaccine and a solution because of the secondary effects, but also the direct effects of this virus. If we talk about the secondary effects, the mental health impact has been enormous. The deterioration in people's mental health from young children all the way through, we've seen time and again in the surgery. Lots of people are now unable to cope because of the level of isolation. We've seen significant deterioration in our dementia patients. At home in particular, who've been isolated, there's been a marked deterioration and a rapid progression of their dementia. Financial implications most people know about, they read about it or they're living it themselves, but it does have a very stark effect on young children and on young families who are seriously struggling. In the health service, that despite our best efforts, yes, we are behind. We're behind with routine procedures, we're behind with some cancer management, we're behind with long-term conditions management. Not necessarily in GP surgeries. I think we've been lucky at Station Drive and in Ludlow. Generally, we've carried on with our care. You know, the hospitals are behind because they just haven't had capacity. And so the harm done by coronavirus is much wider than the illness itself.
I wonder if you could just explain a little bit more about viral overload. We've been hearing about this in the news recently. Could you explain what this is and how it could possibly affect our frontline workers, or how it is affecting our frontline workers?
What we saw with clinicians who've become unwell is that often they are reasonably fit and well people. They don't have chronic underlying illness, and yet a lot of them have done very, very badly when they have contracted coronavirus. Percentage-wise, very few clinicians have contracted coronavirus, despite obviously being repeatedly exposed to it. What the scientists are now proposing, and what we think is happening, is that repeated exposure to the virus, where your body's constantly getting small bouts of the infection, although people are not getting ill every time, eventually with some downgrading of the immune system, when they then actually get the coronavirus and become ill, they are extremely ill. And young patients, or relatively fit and well patients who have respiratory illness, often find themselves in ITU and often deteriorate from respiratory collapse very quickly. And that's what we're seeing. And that's part of why, as clinical personnel, we do feel that we need to protect ourselves. Firstly, so that we can not be at risk of asymptomatically passing it on to our patients. So, because we know that viral overload can have a negative impact.
I have one question. Are you going to have the vaccine?
Yes, I will have it.